What won't you stand for? Violence? Addiction? Cancer? What will you stand for? Mothers? Children? Schools? What do you stand for? Change? Improvement? Redemption? Making an impact starts by taking a stand. Stand strong. Stand now. Start here.
For teens in Indiana, approximately 20% of them have thoughts of dying by suicide, and approximately 10% of them actually attempt suicide. One of our pathway care coordinators was texting with an individual who was at risk for suicide. He indicated to her that he had a knife and he was cutting himself. She utilized the skills that she had learned through all the education we've provided so that he knew it would be best to lock up the knife and to utilize his safety plan to keep himself safe. The goal behind our Zero Suicide Initiative is to ensure intervention at the right time and prevention of deaths, because even one death is too many by suicide.
School nursing is really a commitment that community has made in terms of living our mission. We have nurses in 8 different township schools, and the nurses are there every single day school's in session. Our kids are increasingly sick, have chronic conditions, and the nurse in the school not only really optimizes health for the students, but keeps the kids safe. We've got kids that are on oxygen. We have kids with chronic conditions like diabetes and asthma. We have kids in school that have cancer and are undergoing treatment. There was just a study published that talked about the 10 worst states for children's health. We were actually 4th. There are only 3 states worse in the country in terms of children's health, and that's not a good place to be. Kids truly are the future of our country, and I think it's important that we set them up for success. So kids in the seat, kids learning, kids having a sense of safety at school, all of those kinds of things are what we're looking to achieve.
The Oncology Patient Assistance Fund is a tremendous resource through the foundation in which patients can get a $250 gift card that can be used towards food, medicine, gas. So many of our patients, unfortunately, just don't have some of the resources, and it makes it very hard when they get diagnosed with a cancer. So this provides them with just a little bit of leeway to help get them through that hard time. We have many patients who don't have access to transportation. If they can't come to see us, they can't get the treatments that they need, they can't get better. Fortunately, through the generosity of the donors, we've now established through the foundation a transportation system where cars have been donated, where people can actually be brought to and from their appointments when other family members cannot assist them. Through the foundation, they're exploring the options of having lodging subsidized or provided for patients and their families. And through this option, they will then have the care they need close to home.
Infant mortality is the death of a baby before their first birthday. So in the state of Indiana, unfortunately, the rate is 7.3 lives lost per 1,000 deliveries, compared to a national rate of 5.9 per 1,000 deliveries. Infant mortality, when you think of a descriptor of 42 school buses filled with children heading to their first kindergarten class, that's the number of babies that we lost over the last 5 years in the state of Indiana. Nearly 3,000 lives lost before their first birthday. The CHOICE program is what we've named our perinatal substance program at Community Health Network. That consists of an OBGYN and a nurse practitioner that really started a program embedded in a women's practice office with care coordination with behavioral health services. We also partner with our behavioral health services product line and send our women to group therapy, and that program is called the Momentum Program. A 19-year-old patient lived about an hour and a half away from Indianapolis. She called asking for help. She had just overdosed on heroin, was pregnant, had very little social support, and really needed help. We had a OB Patient Assistance Fund for transportation. We got her into our choice program and really started developing a care plan to help her, and truly that's what saved her life. Just one small thing, having the access to that resource from a donor to get transportation into the program. She's now delivered, she's parenting, she's holding down a steady job, really is leading a successful life as a result of the program.
What won't you stand for? Violence? Addiction? Cancer? What will you stand for? Mothers? Children? Schools? What do you stand for? Change? Improvement? Redemption? Making an impact starts by taking a stand. Stand strong. Stand now. Start here. Community Health Network. Exceptional care, simply delivered.